So we all know that examining kids can be quite difficult. Either they're really scared of us or they just don't want to cooperate. And this happens with point of care ultrasound too. So I've learned some helpful tips and tricks along the way, which I'd like to share with you. So the first one is if you have to have the patient laying supine to do your ultrasound, instead of having the patient lay on the bed where they might feel scared because they're away from their parents, it's actually helpful to have them laying supine in the parent's lap. So you can have the parent sit in a chair and have them lay supine, and the parents can actually help hold the patient when you're doing the ultrasound. Another tricky scan is the skull ultrasound in an infant when you're looking for skull fracture. So for this scan, you actually don't have to have the patient laying down, so you can have them held up in the parent's arms, and then you can actually have the other parent or another healthcare provider help hold the head, so it makes the scan a lot easier. Another scan, which can be tricky due to patient discomfort, will be looking for soft tissue infections or foreign bodies, because the area might actually be quite tender. So you want to have the patient put their, let's say their extremities, or the hand or the arm or the leg, in a position of comfort. You can also put a great deal of gel over the affected area, or you can even put it into a water bath. So you put the probe in the water as well, and you can actually don't even have to put it on the tender area. And that makes the scan a lot easier too. Finally, with any ultrasound, you can actually have the patient sitting in front of a television or in front of a tablet or a smartphone, so it actually distracts them when doing the ultrasound, and it makes it a lot easier. So I think when you're doing any ultrasound, you can use any of these tips, and I think that you'll actually find that ultrasound in kids will be a lot easier.